I'm giving my contact WhatsApp contact number in the link below, so you can message me what video you wanted me to upload. So today we are going to talk about the scalp, temple, and the face and the demand of many of friends. So as we know that the human body is externally covered by soft tissue, skin, uh, alike our at our hand, feet, and rest of the body. The head or the skull is also covered by soft tissue. The soft tissue which covering the skull or cranial vault or the calvaria, that is called the scalp. That is called the scalp. But this scalp is little bit different. This scalp is little bit different in the histology and also in other features from the rest of the body covering, from the rest of the coverings which cover the body externally. So coming to the boundary of this skull, the skull is covered anteriorly. The scalp is anteriorly extending from the supraorbital margins or the supraorbital ridge and this root of the nose, and goes posterior. Its posterior margin reaches straight up to the external occipital protuberance and there the superior neutral line. And on the either sides, it is bound to the zygomatic arch and the superior temporal line. So we have come to know about the boundaries from where this uh, scalp begins and where it goes, which part of the head or which part of the cranium this scalp covers here, from the supraorbital margin to the external occipital protuberance and the superior nuchal line, and there the superior temporal line and the zygomatic arch. Zygomatic arch. This covers the skull or the cranial vault, like other parts are covered by skin. So now this scalp has 5 layers. So we can remember this by the mnemonic scalp, simply by the mnemonic. S stands for the skin, C stands for the connective tissue, A is apocranial aponeurosis, or the anterior part which of this aponeurosis is called the Gallia aponeurosis. This aponeurosis is nothing but it is a tough band of the tissue. This aponeurosis is a tough band of the fibrous tissue which extends from the root of the nose and root of the nose up to the external occipital protuberance, and this is responsible and this gives insertion to the muscles, both frontalis or the frontal belly or the occipitalis or the occipital muscle, occipital bellies. So it gives attachment to both these muscles. And then we have the loose areolar tissue. Loose areolar tissue, this often is later, this is considered as a dangerous area of the scalp, because in this loose areolar tissue there are various blood vessels which communicate this blood from outside of the skull to the inside of the skull. For example, parietal emissary veins, these communicate this blood from outside the skull to the inside of the skull. So in any type of the infection, pus, or any pathogen, they are easily transmitted in the skull. That is why it is considered as the most dangerous part of the skull. So this should be noted. The loose areolar tissue is considered as the most dangerous part of the skull. Why? Because any infection, pathogen, or the pus in the loose areolar tissue is easily communicable inside of the skull. And the fifth and the last layer of this scalp is the pericranium. This pericranium closely invests the skull, closely invests the outer border of the skull bones. Whether it is the parietal bone, it is frontal bone, it is temporal bone, or occipital, it closely investigates, and often it is embedded within the sutures. We know that our skull have joints, that joints are sutures, they are not mobile. So first the joint between this, that is the there between the this to parietal and the frontal, that is the coronoid suture. Then we have the sagittal suture, and then we have the occipital suture. What is this called? These sutures, this is closely embedded within these sutures. So now coming to the blood supply, blood supply of the skull, blood supply of scalp.